Hello friends, today we'll discuss about this is a part 2 that is a clinical clues to make the diagnosis easily. Okay, so here the first question is history of hypopigmented patches and acid fast bacilli, and it's a cigar bundle shaped. Okay, so usually the history will be like they will be mentioning it is an hypopigmented patches, that is it can be a macule or it can be straightforward, it can be given as a patch. But one thing is you want to remember whether they have given the word like acid fast bacilli, or they can simply give the bacilli has been arranged like a cigar bundle appearance. Okay, so they won't give the clues very clearly. Okay, it will be like cigar, either it can given like cigar bundle appearance, or they can give it as an acid fast bacilli. Okay, so some other clues like there will be the patient on examination there was an any ulnar nerve thickening will be there. Okay, so if you come across these words, so you can it is nothing but it is a Mycobacterium leprae. So another clue, if they have given like hypopigmented macules or hyperpigmented, and if they have given about KOH. Okay, so in KOH there is an spaghetti and meatball appearance, then it is a tinea versicolor. But here I have given it is an acid fast bacilli. So here the answer is Mycobacterium leprae. So coming for second question, history of painless and slow growing hard moss with cutaneous fistula, and they can given like this infection started after the insertion of the IUCD. Okay, and then so on examination the granules have found to be hard and it is a non-emulsifiable. So if you come across these words, it is a nothing but it is an actinomycosis. Okay, so I think you know what are the other important points here is, so in the cervicofacial actinomycosis it is a most common. Okay, so after the IUCD infection the patient will be presenting with pelvic actinomycosis. So rest of all the points will be then same only. Okay, so here the sulfur granules are hard and non-emulsifiable, whereas in nocardia it is in soft and emulsifiable. So that is the differentiating points between these two species. So here the main point, and this have been asked in examination, that is after the IUCD insertion the patient developed an infection. Okay, so next question is the most common form of neonatal meningitis. So in the previous session I told if they have given what is it, Streptococcus agalactiae, you can, that is a group A Streptococcus, you can mark it as correct answer, or if they have given the option of Listeria, okay, you can also go with that Listeria also. Okay, so these are the most common cause for the neonatal meningitis. So coming for next question, history of fever, malaise, headache and painful lymphadenopathy and Weissenstein stores and shift tip in appearance. So here the Weissenstein is a clay point. Okay, so again this is a previous year question. So they can given like a farmer. Okay, a farmer developed a fever and then there is an inguinal, the most common it is an inguinal lymphadenopathy. So on examination we found it to be a tender, and then on Weissenstein it shows a safety pin appearance or the bipolar appearance. So whatever they can give it, and so here the answer will be in Yersinia pestis. As you know what is this, the pain culture is, it will be like stalactite growth. So these are the important point you want to remember, and it will be causing that is a black death. Okay, so coming for next question, history of bloody mucopurulent stool and tenesmus and abdominal cramp. So you want to remember whenever there is a term bloody mucopurulent stool, so first you want to remember like it is an either it can be like bacteriology, or it can be in like any parasitic organisms. Okay, so coming for bacteria it is usually Shigella. Okay, so coming for the parasites, so mostly it will be in Entamoeba histolytica, so that I will be dealing later. So here, so how you can come to diagnosis is, so I am sure they'll be giving some of any selective media. Okay, they can give like selective media, that is in DCA. Okay, so with this clinical features, you want to correlate with some other points, like that is, so in microbiology, it is usually the examination findings, that is, it can be in the gram stain. So they also give the gram stain showed a gram negative bacilli. Okay, so some clues will be there, but the main clinical point you want to remember here, it is in bloody mucopurulent stool. That is nothing but it is in dysentery. So coming for next question. So history of thick mucoid brick red sputum on the current jelly like sputum. Okay, so it is nothing but I think the question is clear cut. That is a Klebsiella pneumonia. So friends, again you want to remember there is another organism, that is they can give like the sputum was red in color, but in examination there was no RBC. So again in culture plate also there was a red colored colonies. So if they given like in culture in red color colonies, then it is in Serratia. Okay, Serratia marcescens. But in this for Klebsiella, for Meconici agar, it will be showing a lactose fermenting colonies, whereas in Serratia it will be in red colored colonies. Okay, so this red color, it is mainly because of the pigment it is in prodigiosi. So you want to remember these 2 points. So one is Klebsiella pneumoniae, so another it is in Serratia marcescens. So coming for next question. So history of renal calculi, or so they can give like the patient developed in UTI, and after that there was an on USG they found to be in renal calculus. If the question is more specific, they can even give two-weight stones. When you come across two-weight stones, it is nothing but it is in Proteus. So in Proteus, you want to remember the another important point, that is it is in Dian's phenomenon. So Dian's phenomenon, it is for the Proteus. So whereas Dian's method, it is for mycoplasma. Okay, so you want to remember these 2 important points. And I'm sure mostly they will be giving only renal calculus history. If we are lucky, they can give like two-weight stones. Okay, so on this will be a more cut clear to choose the option Proteus. Okay, so coming for next question, now history of fever, rose spot, abdominal pain, vomiting. Yeah, it is nothing but it is in Salmonella typhi, and what they are mentioning here, it is in typhoid fever. So sometimes they can give the step ladder fever, but I am sure that I think it is in 95% they can give. So remaining you want to make out. They can give some other clues like, okay, so patient developed a fever, and on doing a viral test they can give, or they can give like in culture media, it showed in black jet colored colonies. Okay, so these are the some other clues to make out the diagnosis for Salmonella typhi. So this black jet colonies, it is usually seen in the Wilson and Blair medium. Okay, and so some other important point here is, so you want to remember these spots, that is in rose spots. Okay, so they won't give it directly, but they can give history of fever and the patient developed as spots, and on examination we found to be a mild hepatomegaly was there, and on vital test this was significant titer, or they can give the culture media. So whatever it is, so some point will be there so that you can make out the diagnosis. Okay, so okay, next question. So here history of rice watery stool, vomiting and muscle cramp, and the organism shows starting motility. Okay, so again this is a previous year question. So here whenever they are coming as rice watery stool, it is in cholera, you can make out, but I am not sure they will give this clue directly. So what they can give is, so patients presents with diarrhea and the organism showed a darting motility. Okay, so and there was a severe electrolyte imbalance. Okay, so that this cholera will be causing a severe electrolyte imbalance. So these will be the clues, and they can also ask what will be the selective medium you will be using. Here is thiosulfate citrate bile salt sucrose medium. Okay, that is it is in TCBS medium. So coming for next question, history of burns. Okay, so this organism will be growing in a disinfectant. So mostly this the organism history of burns means it is nothing but it is in Pseudomonas. So the important point you want to remember here is so after the burns, the patient will be developing an infection, so which is resistant to almost all the organisms. So history will be in this way. Okay. So and that's a special property for Pseudomonas. It is that it will be growing in a disinfectant, as you know that, right? So if you come across these points, it is nothing but it is in Pseudomonas. Okay. So thank you, friends.